Hello, everyone. Welcome to the Life More channel. Do you know what the warning signs of tuberculosis are, a disease that affects millions of people worldwide? If you're not subscribed yet, make sure to subscribe and hit the bell icon to receive all our health tips. In today's video, we're going to discuss the main symptoms of pulmonary and bone tuberculosis. We'll explore these conditions and understand how to identify early signs. Let's get started. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It usually affects the lungs but can also target other organs in the body, such as bones and the nervous system. Tuberculosis is primarily transmitted through the air when an infected person coughs, sneezes, or talks, releasing small droplets containing the bacteria into the air. These droplets can be inhaled by others, exposing them to the infection. The main way to prevent tuberculosis is to avoid close contact with infected individuals and maintain good respiratory hygiene. Treatment involves using antibiotic medications for a long period, usually from 6 months to a year, to eliminate the bacteria and prevent the spread of the disease. It's important to be aware of tuberculosis symptoms, so stay tuned to learn about the symptoms of pulmonary and bone tuberculosis. Pulmonary tuberculosis. Pulmonary tuberculosis is a common form of the disease, mainly affecting the lungs. Let's now examine the symptoms associated with this condition. 1. Persistent cough. A persistent cough is a common symptom of pulmonary tuberculosis, a severe bacterial infection affecting the lungs. Typically, a cough becomes persistent when it lasts for more than 2 weeks and shows no signs of improvement. In pulmonary tuberculosis, the cough can be dry or productive, with or without sputum. Persistent coughing occurs due to inflammation of the lung tissues caused by the bacterial infection. This inflammation leads to continuous irritation of the airways, resulting in frequent coughing episodes. It's essential to seek medical attention if you have a persistent cough, especially if it's accompanied by other symptoms like fever, night sweats, weight loss, or shortness of breath. Early diagnosis and proper treatment are crucial to prevent serious complications from pulmonary tuberculosis and promote full recovery. 2. Coughing up blood. Coughing up blood, also known as hemoptysis, is an alarming symptom that may indicate various lung conditions, including tuberculosis. When blood is present in the sputum, it can be bright red or dark, depending on the amount and source of bleeding. In tuberculosis, bloody sputum usually occurs due to inflammation of the lung tissues affected by the bacterial infection. It's crucial not to ignore the presence of blood in the sputum, as it may indicate a serious condition that requires immediate medical evaluation. Besides tuberculosis, other possible causes include respiratory infections, lung injuries, chronic bronchitis, pneumonia, and even lung cancer. If you have coughed up blood, seek medical assistance for proper evaluation and treatment. Early diagnosis is essential to ensure the best outcome and prevent serious complications. 3. Fever and night sweats. Fever and night sweats are common symptoms of pulmonary tuberculosis, a contagious bacterial disease that affects the lungs. Fever is the body's immune response to bacterial infection, characterized by an increase in body temperature above normal, usually exceeding 38 degrees Celsius (100.4 degrees Fahrenheit). Night sweats are episodes of excessive sweating during the night, even in moderate ambient temperatures. These symptoms occur due to the activity of the immune system in an attempt to fight bacterial infection. Fever helps create a less favorable environment for bacterial growth, while night sweats may be the body's response to increased internal temperature. It is essential to seek medical attention if you experience persistent fever and night sweats, especially if accompanied by other symptoms such as persistent cough, fatigue, unexplained weight loss, or shortness of breath. Early diagnosis and proper treatment are crucial for controlling pulmonary tuberculosis and preventing serious complications. 4. Fatigue and weakness. Fatigue is a persistent feeling of extreme tiredness, which can affect the ability to perform normal daily activities. Weakness is the loss of muscle strength and energy, resulting in difficulty performing physical and mental tasks. These symptoms occur because the body is fighting bacterial infection, which can lead to widespread inflammatory response and the release of substances causing fatigue and weakness. Additionally, tuberculosis can interfere with the absorption of essential nutrients by the body, leading to weight loss and muscle weakness. It is crucial to seek medical evaluation if you experience persistent fatigue and weakness, especially if associated with other symptoms such as persistent cough, fever, night sweats, and shortness of breath. Early diagnosis and proper treatment are fundamental for tuberculosis control and prevention of serious complications. Bone tuberculosis. Bone tuberculosis is less common but still important to recognize. Let's explore the signs associated with this form of the disease. 1. Persistent bone pain. Persistent bone pain is a concerning symptom that may indicate various medical conditions, including bone tuberculosis. In bone tuberculosis, pain is usually caused by inflammation and destruction of bone tissues due to bacterial infection. This pain is often described as deep and persistent, worsening over time and often affecting specific areas of the body such as the spine, hips, or knees. As the infection spreads to the bones, the bone structure may weaken, leading to deformities and movement limitations. Persistent bone pain in bone tuberculosis is a warning sign that should not be ignored. It is important to seek immediate medical attention when experiencing these symptoms, especially if accompanied by other signs of infection such as fever, night sweats, and unexplained weight loss. Early diagnosis and proper treatment are essential to prevent serious complications and improve treatment outcomes. If you are experiencing persistent bone pain, do not hesitate to seek medical guidance for proper evaluation and care. 2. Swelling or bone deformity. Swelling or bone deformity are indicative signs of possible complications of bone tuberculosis, a less common but serious form of the disease. When a person is affected by bone tuberculosis, bacterial infection can lead to inflammation and destruction of bone tissue, resulting in changes in bone structure. Swelling may be observed as an abnormal increase in volume around the affected joints or bones. This swelling may be accompanied by visible or palpable bone deformities. As the infection develops, bones may lose their normal shape and function, leading to noticeable structural changes. These signs are often accompanied by persistent pain and limited movement in the affected areas. It is essential to seek immediate medical attention when noticing bone swelling or deformity, as this may indicate a severe infection requiring urgent treatment and specialized care to avoid additional complications and promote proper recovery. 3. Movement restriction. Bone tuberculosis can cause movement restriction in the affected joints. This occurs due to inflammation and deterioration of bone tissues, which can affect normal joint function. As the infection progresses, the joint may become stiff and painful, making movements difficult and limiting the range of motion. Movement restriction may be perceived as difficulty in fully bending or extending an affected joint, as well as a feeling of stiffness when attempting to move. These symptoms can interfere with daily activities and significantly affect the individual's quality of life. It is important to seek medical assistance for proper evaluation and treatment if there are signs of movement restriction associated with bone tuberculosis. Recognizing the signs of tuberculosis, both pulmonary and bone, is vital for early detection and effective treatment. Persistent cough, coughing up blood, fever and night sweats, fatigue, persistent bone pain, swelling or bone deformity, and movement restriction are crucial indicators that should not be underestimated. If you or someone you know has these symptoms, it's really important to see a doctor right away. Tuberculosis is a serious illness, but it can be treated, especially if it's caught early. It's important to spread the word about this illness. Share this video to help people learn about the symptoms of tuberculosis and stop it from spreading. Subscribe, like, and share. Together, we can make a difference in the fight against tuberculosis. Thanks for watching, and see you next time.